When we say skin tightening, do we really mean face tightening? What's the difference? Well, we use the term skin tightening all the time in aesthetics. So you come in to see me with really fine lines and wrinkles, or you come in to see me with jowls and your face feels like it's hanging off onto your chest. Often you will hear, well, we'll tighten your skin with X, Y, and Z treatment. And realistically, that's a load of baloney. And let me explain why. I've done a reel about face tightening before. So really, if you got this happening, that is what you need to do. And that's face tightening. And honestly, surgery is the best and pretty much the only solution for that. I've done a reel, as I say, and on it I talk about how just above the bone in the face, you've got a deep muscle fascial layer, muscle and connective tissue, above which there's more connective tissue, above which there's more muscle and connective tissue, above which there's fat, and then there's skin. So multiple layers beneath the skin are sliding down. So how on earth is skin tightening going to do that? Realistically, it can't. It's marketing baloney. Skin tightening, well, the skin is only 2 millimeters deep on the face. And actually, to get true skin tightening, which means anchoring the top layer of skin to the layer of skin beneath it, that's happening about 0.2 millimeters down. So really, really superficial. Now, how do we do that? Well, there's a number of treatments: microneedling, CO2 fractional lasers, although studies show that maybe microneedling is as good as that. Silicos is the only injectable that is shown to give all the proteins necessary to refresh that layer, which is why I'm such a fan, and now I'm not affiliated. But I've done a reel on that too, and explaining why and what that layer does and why it's important. But realistically, you're talking about fine lines and wrinkles. You're talking about tiny textural abnormalities on the skin. You're not talking about shifting huge volumes of deep tissue. You can feel the weight of it if you do this. How much is there? The top 2 millimeters, the top 0.2 millimeters of your skin, they're not going to make a difference to this. Let's be realistic. As an industry, we need to be a lot more honest with the terms that we're using. And I think you, as members of the public coming for these treatments, need to understand anatomically, skin tightening is not going to do this for you.